My name's Martin Raglan. I'm a foot and ankle consultant surgeon based here in Nottingham. My specialist interest is all foot and ankle conditions ranging from pain, deformity. I provide operative and non-operative options in the management of any foot and ankle condition. My background by training is a medical doctor. I've then done 12 years of further higher training as an orthopaedic surgeon and then subspecialist training as a foot and ankle surgeon. And that's now my entire specialism. The reason I love foot and ankle is it's very varied, and it's everything from problems with regards to deformity of your lesser toes, to pain in your ankle, a deformed ankle, pain around your tendons and ligaments. So it's a very varied bag. And the best thing is often to see me early, to see a foot and ankle specialist early, so we can try and identify where the source of a person's pain is coming from and to set them on the right pathway to make a good recovery. The good news is a lot of foot and ankle conditions can settle on their own, but any person who's struggling with pain, any deformity, any symptoms that are persistent and not improving, then it would be worth to get an early opinion to just see if there's anything that needs investigating sooner than later would be my preference. And the good news is a lot of the conditions can be managed initially non-operatively. And it's just having a good discussion with the right person at the right time to direct you the right way. So I guess a lot of my patients, when they come to see me, aren't quite sure what's going on. A lot of my patients have looked up conditions on the internet and have an idea, but they're struggling to access a specialist opinion. And the advantage of coming to see me is we can have a proper discussion. I have the advantage to examine you, request further imaging that can be achieved promptly, and advise you of the best way of managing your pain or your condition. And that allows you to make a much faster and optimizes your chances of a recovery that's prompt. And that's the advantage, really, of coming to see someone early. Probably the three commonest conditions that I see is one is bunions, the hallux valgus deformities. The second is soft tissue problems, so Achilles tendinopathy or lateral ligament sprains. And then the third is deformity and pain, which is really secondary to arthritis around the foot and the ankle. And the good news is a lot of these conditions can be managed non-operatively, and it's just taking the patient through that whole process, making sure that they're doing the right things to prevent injury, to try and recover from injury as quickly as possible, and to manage their symptoms. But ultimately, when non-operative management is not working out, then operative intervention to discuss the surgical solutions that we can really improve and enhance the patient's quality of life. And that's, at the end of the day, what I want to do for patients, is improve their quality of life with their pain, deformity, or instability. Common questions I have is, will these get worse? Is it related to shoe wear? The reality is the bunions are predominantly due to sort of family history and genetics, and they can be exacerbated by tight-fitting shoe wear. But reality is that non-operative measures are very difficult to prevent the bunion deformity getting worse. And often it's a discussion about the pros and cons of surgery and when it's right for that person to have the surgery to make it better. And that's quite a satisfying operation to do, and a lot of people are very happy with that operation. The other commonest injuries that I see are people, especially younger or sportier people that struggle with pain around their ligaments, pain around their Achilles, that have seen a lot of physiotherapists and are struggling, and then it's a discussion of what surgical management options there are to try and resolve that. And also working in partnership. A lot of what we do now is in partnership, working with the physios and the podiatrists, the foot practitioners, and myself to try and optimize and have a holistic approach to improve the patient's journey to get them back to where they were functioning before. The way I record patient outcomes there are two sort of measures. A subjective outcome is what the patient reports, and currently a lot of my patients fill out questionnaires to subjectively report how they're feeling before the operation to assess their pain, and how they're feeling after the operation. One of the operations I do, for example, are ankle replacements. And as part of ankle replacement surgery for ankle arthritis, all my patients fill out PROM scores, similar to hip and knee patients, which goes into the NJR. And so you can actually look at my outcomes on the National Joint Registry under Mr Raglan. The key thing with working at the park is the team and the staff. I find the staff very friendly, very welcoming, and I think that works well for patients who come here and have generally a very good experience. So I'm quite pleased here. I love surgery. I think so. When I went to medical school, there's a choice between medicine, which is predominantly ward-based, and surgery. And I always enjoyed surgery because often there's a more targeted way of solving a patient's problem and getting immediate satisfaction and immediate relief for the patient. So that's why I chose surgery. My subspecialism was orthopaedics and then foot and ankle. And the reason I chose foot and ankle is I just find it fascinating. It's very interesting. There's a whole mixture of pathology ranging from lesser toe deformities to significant hindfoot problems. And so that's why I really enjoy seeing patients talking through their problems and making them better. And that's why foot and ankle for me is the best subspecialty. With foot and ankle, the good news is the majority of surgery that is offered once non-operative options have been exhausted is all done as day case. So most people have the surgery where they would discuss it with the team, myself and my anaesthetic team, whether they would have it under regional or a local block, just numbing the toes or the foot or the area that's operated on so you're awake, or having a general anaesthetic where you're asleep. And most people would have the surgery, and then they would be able to, for example, if it's a bunion or if it's a midfoot problem, you'll be able to walk on it straight away in a post-op shoe, and you would go home that day. Most people are resting for 2 weeks to keep the feet elevated to allow for the swelling and pain control. And then they're seen at 2 weeks and at 6 weeks, and a majority of symptoms settle between 6 and 12 weeks. So the recovery is pretty good. Most of it is done as day case surgery, and you are allowed to get back to most of your activities pretty soon. The caveat with that is if it's something more labour-intensive or more physical job, then you will need a bit longer recovery time. The good news is, especially here at the park, we're taking very strict measures to make it as safe as possible. And as you can see, there's good screening measures in place. There's adherence to national guidelines to actually allow us to operate safely on patients. And one thing I think it is important is if you are struggling with pain, it is worth having a discussion with your surgeon about the pros and cons of surgery and accepting the risks. The risks now, with the measures in place for planned surgery, are very low, and I think we are open to offer surgery for a lot of our patients, and you have to have that discussion if it's the right thing for you. Clearly, the best thing is seeing a patient, diagnosing the problem, treating the problem or doing the surgery, and then seeing the outcome and seeing how they improve following that and getting back to their lives. And that's why we all do it, not just me, but all my colleagues, is that satisfaction when the patient's symptoms have resolved, they've improved, and their quality of life is back to where they were. And that's what we really enjoy.